In this video, we will be discussing the instruments used in tonsillectomy and adenoidectomy. This video is made under the guidance of Dr. Tarun Ojha sir, Professor and Head, Department of ENT and Head and Neck Surgery, Mahatma Gandhi Medical College and Hospital, Jaipur. Before we proceed with the video, you should know some important points regarding the exam. In your practical exam, when you are asked about any instrument, the examiner can ask anything related to the particular procedure. For example, if you get a tonsillar snare, the examiner can ask anything about tonsillectomy procedure, indications, contraindications, and complications of tonsillectomy and diseases related to tonsil like acute tonsillitis, chronic tonsillitis, membranous tonsillitis, tonsillolith, etc., and also about the normal anatomy and functions of the tonsil. Now, to begin with the instruments, first we start with the mouth gag. This is a Boyles-Davis mouth gag. The blade is known as the Boyle's blade, and this is a jaw piece which is named after scientist Davis. This is a procedure how you fix the blade in the mouth gag. We place it in the mouth of the patient, then we gently open it in order to open the mouth wide open. This has a rubber caulking. This is to prevent the injury to the incisor teeth of the patient. The use for this mouth gag is, it is used in dissection method of tonsillectomy, operations of the palate and the nasopharynx, operations of the pharynx, adenoidectomy, and craniovertebral anomalies. Next we come to the Droffin's rod. These are the metallic rods which are used to fix the Boyles-Davis mouth gag. We take these rods and we put it in these holes of this plate, and then we approximate them and we fix the mouth gag into these holes of the rod. The use is to fix the Boyles-Davis mouth gag to the operating table. Coming to the next instrument is a Dennis Brown tonsil holding forceps. It has got a box joint and an angular instrument. There are two sizes. It is either in a large size or a small size. We hold the tonsil in the mouth of this instrument and then we pull and retract the tonsil in order to provide a good plane for dissection of the tonsil. The next instrument is the Mollison's tonsil dissector and the anterior pillar retractor. This instrument has two different instruments. This is the anterior pillar retractor and this is the tonsil dissector. This is used to dissect the tonsil from the tonsillar bed in order to provide a bloodless field. After the dissection, we can retract the anterior pillar through this end and see if there is any remaining tonsillar remnant present in the bed, or to see if there is any bleeding point in the tonsillar bed. Next we come to the tonsillar snare. It is known as the Eve's tonsillar snare. This has this portion, this ring is to put the thumb and these two are to give support to the fingers. We have a wire end. We have a wire on one side of the instrument. After dissecting the tonsil from the tonsillar bed, only when the stalk of the tonsil is left, we introduce this snare inside the oral cavity. We pull the tonsil out from this ring. Then gently we close this instrument in order to reduce the circumference of this wire, and then we hold it from the stalk of the tonsil. Then we gently crush the tonsil and then we push it like this to separate the tonsil from the tonsillar bed. This method of coagulation will release the tissue thromboplastin factor, which is useful for the coagulation cascade in order to prevent bleeding. Next is the Negus artery forceps. This is a curved artery forceps. This is used to ligate the bleeding points which are seen in the tonsillar bed. We hold the bleeding point, then we use this curved tip Negus artery forceps in order to ligate the tip of the bleeding structure. This is a Yonker suction. This is used to do the suctioning of the oral cavity and the tonsillar bed in the tonsillectomy procedure. we have to keep in mind that we never directly suction the tonsillar bed side as it can lead to bleeding. Therefore, we place either a cotton or a gauze in the tonsillar bed and then we suction it over the cotton. Now, this was it about the tonsillectomy procedure instruments. Coming to the adenoidectomy, this is the main important instrument which is used. It is known as the St. Clair Thompson's adenoid curette. It is of two types. This is one without cage and this is one with cage. This is a cage which is present in the adenoid curette. This is used to approximate the tissue in place so that after we remove the adenoid from the oral cavity, the remaining tissue doesn't spill off in the nasopharynx. And therefore, this is with cage and this is a without cage. So this was all about the instruments which are used in tonsillectomy and adenoidectomy. To repeat, you have to be thorough with the anatomy, physiology part of both the adenoids and the tonsils and the procedure of tonsillectomy and adenoidectomy. Thank you.